Well, thank you for joining us at this town hall meeting tonight, and I really appreciate everyone that can join us, and also for those listening to the recording or watching the recording. We really appreciate you very much. And there's just some logistical notes I'd like to go over. This session is being recorded so that you can share it and watch it later on demand. And any questions that you have during this live town hall can be placed in the chat, either to the entire group or directly to Kim Murdoch. And so just an overview of the agenda today. We're going to talk about our work on a new strategic plan, very, very, very important to the direction of NAMI New Hampshire. We're also going to talk about NAMI New Hampshire's statewide work in 2024. Some general legislative priorities for mental health and suicide prevention in 2024, and the 2024 legislative session, and also specific bills to watch. And then, of course, at the end, we're going to have a question and answer time. And then what I'd like to do right now is introduce our Executive Director, Susan Stearns. Susan.
Thank you, Todd. That was Todd Donovan, our board president. Very grateful to you for your leadership. Welcome, folks. I'm going to share my screen here and get us started. Bear with me for a moment. There we go. All right. So welcome again to our annual virtual town hall. We're really thrilled to have you here and give us a chance to update you on what we've been up to and where we think things are going in the coming year. As Todd said, we're going to talk a little bit about strategic planning in the coming year. But before we do that, I want to do a sort of level set where we are today, and as we think about this work, which is, as Todd said, so important in terms of our strategic plan. Probably most, if not all of you, are familiar with both our mission and vision. We're a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. Last year, we served nearly 44,000 folks, which was made possible only through the tireless efforts of our 64 staff and over 200 statewide volunteers. We are incredibly grateful to you all and to all of our supporters to help make it possible for us to do this work. So this is some data that I think a lot of folks are probably familiar with, according to NAMI National, from their information from the National Institute on Mental Health and the CDC. 1 in 5 Americans experiences a mental illness in any given year, about 1 in 6 kiddos. I think it's really important to note this 3 in 10 number. This is a number we've been tracking since the onset of the pandemic. And a little bit of good news, last year, this was 4 in 10 adults reporting symptoms of depression and anxiety. So we are seeing a little bit of change in those numbers and the impact of COVID. Similarly, we've been looking for the last several years through the efforts of, thanks to the efforts of particularly the Kaiser Family Foundation, where this data is being tracked, at what that impact is on adults since the onset of the pandemic in 2020. I do want to point out that indeed in 2019, this data indicated about 11%. That isn't on this chart, so about 11% of adults reported symptoms of anxiety or depression. And as you can see, there was clearly a significant spike with COVID, and those numbers have stayed elevated, yet have come down a little from where they were in the depths of that pandemic winter. We continue to see, youth and young adults, and here this shows how young adults, this 18 to 24 range, that long bar at the 49.9%, are reporting those symptoms. So we're hearing this, the younger you are, seemingly the more you're impacted. I do think it's interesting to note that it also correlates, as we know, with these social determinants of health, like in this instance, job loss, that played a significant role in folks, in the impact on folks. We also have been recognizing that we've had a children's mental health crisis for many years that was truly exacerbated through the pandemic. Indeed, in the last 3 years, all of these very important groups looking out for our children's mental health have, issued a sort of a clarion call about the fact that our youth are facing a mental health emergency. Here in New Hampshire, we really have seen this in terms of the state's high fidelity wraparound model, Fast Forward, which NAMI New Hampshire is a participant in February of 2020. So right before the world shut down, they were just under 200 kiddos enrolled in that program. And today there are over 500. So we do see that there has been a significant impact on children here in New Hampshire every day. The most recent Youth Risk Behavior Survey for, this is national data here, but we will be talking a little bit about New Hampshire's data, and which pretty much mirrors this in terms of showing how high school students were impacted with these persistent feelings of hopelessness and sadness, showing before and after the pandemic. So we clearly see an impact. I think one of the things that we're going to touch on a little bit tonight is how our young females are even more impacted, as well as folks in what we might consider more traditionally marginalized groups. So laying that foundation is really important as we look at our next strategic planning process. These are the current strategic plan goals. This strategic plan will be in effect through June 30th of 2024. So we are currently engaged in a new strategic planning process. We are once again using Patrick Miller of Helms & Company. Patrick has helped facilitate us. This is our third time for doing a strategic planning process with him. And so just so you get a little bit of sense, in developing the current strategic plan, which has these 4 goals: advocate for public policy and systems change, update educational and support programming, as well as incorporate diversity, equity, and inclusion, or DEI principles across our work, and supporting our operational capacity so we can continue to do our important work. One of the things in developing this plan, I think it's really important to know that Patrick does a robust surveying process, and this was informed by 45 survey responses from our volunteers and others, and then also a dozen external interviews with key stakeholders around the state. As I said, we are currently underway with a new strategic planning process. I'm really thrilled to tell you that this time around, there have been 75 survey responses, which is a significant increase from last time around, and we have 17 external interviews happening. So we are looking to have the most robust information from our NAMI New Hampshire family in helping us develop this next strategic plan. One of the things that was really integral in this plan and that the board felt was very important, and that was echoed by our volunteers and supporters in responding to the survey 3 years ago that informed this plan, was this recognition of the fact that we needed to do better around diversity, equity, and inclusion. That although we were founded at Peggy Straw's kitchen table in an effort to ensure that people living with serious mental illness could live full lives in their communities, free from discrimination, that here at NAMI New Hampshire, we had not done as much as we felt we should be doing to ensure that we were truly being inclusive and providing a place that felt like a place where folks belong, no matter what communities you come from, what background you come from, and ensure that the services we are offering are accessible to all Granite Staters. So we incorporated as one of the 4 foundational goals in the strategic plan, this incorporating DEI principles. And out of that, we have continued this with a significant amount of work, including the establishment of a DEI committee that is comprised of staff, board members, and volunteers, and then embarked upon this journey to help ensure that we are incorporating these principles in everything we do, in our governance structure, in how we handle our human resources policies, in our programming, in our advocacy work. So this has been a almost 3-year journey for us. thrilled to be able to tell you that we are now offering quarterly DEI trainings for board volunteers and staff. Indeed, next week we have active bystander training coming up. The committee continues to meet monthly. We are working hard at ensuring that we stay up to date with our HR policies and our governance structure to ensure they are inclusive. There is an internal DEI newsletter to help inform everyone in the organization. And we have expanded some of our offerings and in terms of programming, and also updated them to make them more accessible. So one of the things that we wanted to share with you tonight is sort of an update on our legislative priorities for 2024. The legislature resumed its work back at the beginning of this month, and it is a very busy session, and you'll hear about that from Holly Stevens, our Director of Public Policy, and Sam Hawkins, our Public Policy Assistant, in just a moment. I'm going to just quickly touch a little bit on the emergency department boarding issue. As folks are very familiar, unfortunately, New Hampshire has been facing this challenge for over a decade. Indeed, in December, we had an average of 28 adults and, sorry, covering up on my screen, 13 children, most of whom were boarding in emergency departments, waiting for an available inpatient psychiatric bed. I want to tell you that I updated the slide from last year, and both of those numbers ticked down like by one. So I think we are seeing that things we've not had a dramatic shift in the past year. And we do know that this is a problem that stems from multiple causes, including not just needing more capacity in terms of inpatient beds, but it's compounded by all those workforce issues that we all hear about, and of course, access to affordable housing. And that's access for both people living with mental illness and for folks who want to come to New Hampshire, for example, and work here and be part of our mental health workforce, that indeed affordable housing is a challenge in recruitment for that workforce. So those issues are connected. Folks may be familiar that last May, the U.S. District Court for the District of New Hampshire issued a permanent injunction that gives the state a year in order to come into compliance, where they would accept someone for transfer to a designated receiving facility bed, such as those at New Hampshire Hospital or other designated receiving facilities in the state, that they would be able to do that within 6 hours, accept someone for transfer. So there's clearly a lot of pressure on the whole system to accomplish this goal, and the New Hampshire Department of Health and Human Services has embarked upon a project called Mission Zero. This initiative is a collaborative effort to really address this problem, and by collaborative, it includes people from the hospitals, clearly New Hampshire Department of Health and Human Services, the community mental health centers, as well as NAMI New Hampshire, as we work towards trying to accomplish the goals in Mission Zero. And Mission Zero really looks at it from sort of looking at these three key drivers, being front door issues, where folks who are in crisis have trouble, accessing timely services, so may then require a higher level of care, to those issues around just having capacity in our designated receiving facilities, and those backdoor issues, where we know people who are often clinically ready for discharge don't have an appropriate place to be discharged to, whether they lack housing or they require, for example, supported housing in the community. So the Mission Zero is really looking at addressing those three key drivers. The first one through the expansion of the Certified Community Behavioral Health Center model clinic here in New Hampshire, which will allow for better integration of mental health and substance use disorder treatments, expanding and actually establishing community-based crisis stabilization. So this is not an overnight bed, but a place where someone can go during a crisis for up to 23 hours. And then establishing a system for care traffic control, which just launched just about a week ago with a soft launch to have better help people navigate from emergency department to the appropriate facility. And that is already showing some real promise. There will also be some expansion in that inpatient capacity. There are a couple units at New Hampshire Hospital being renovated that will be coming online soon. And then a new facility being built by Solution Health down in the Derry part of the state, as well as some beds at Dartmouth that will be coming online in next year. So we will see more inpatient beds. And then in terms of those backdoor issues, there was an expansion in terms of step down and less restrictive care, including transitional housing, more permanent supported housing, and then also landlord incentives to help encourage landlords to have folks who are in that position of being discharged from a designated receiving facility, encourage landlords to be more open and to those folks coming into living in their apartments. So with that, that's sort of a real high level vision of where things are with the emergency department boarding and Mission Zero. I'm going to turn things over to Holly and Sam.
Great, thank you, Susan. Sam and I are going to be going through some bills that NAMI New Hampshire is working on this legislative session. So just really quickly, because we know we don't have a lot of time. But for suicide prevention this year, there's two groups of bills that we're really focusing on. One is on a certain population of young folks, because we know that the LGBTQ population, especially teenagers, are in increased risk for suicide. We're working on some of those bills with the lens of suicide prevention. There is a bill that would allow for the classification of individuals based on their biological sex determined at birth. That's House Bill 396. There's House Bill 1185 relative to sexual education instruction, which is regarding schools, and it would prohibit the teaching on what they call the teaching on sexual lifestyles. But what it means is that teachers, counselors, or any school personnel would not be able to talk at all about sexual lives, whether it's being heterosexual, homosexual, transsexual, asexual, gender fluid, anything along those lines would not be able to be mentioned in schools. There's also a bill, House Bill 1356, relative to the use of children's names and pronouns by public school employees. And that bill would prohibit individuals from using pronouns and or names of children that were not given to them at birth, unless there was explicit permission from the parents on file. Another group of bills that we're working on center around firearms this year. There is a bill, Senate Bill 360, which is relative to extreme risk protection orders, which would allow for people close to an individual, a significant other, or a family member living in the household, would allow them to petition the court to temporarily remove somebody's guns if they felt like they were a danger to themselves or others. There's also a bill that would impose a 72-hour waiting period on the purchase and delivery of a firearm. We know that any amount of time you can put between somebody making the choice to end their life by suicide and the actual means by which they would do that, any delay you can cause between those two items does reduce the risk of death by suicide. And then there's also a bill that would establish a voluntary waiver of the right to purchase a firearm. That's House Bill 1050. This bill would allow folks who know that they struggle with thoughts of suicide to voluntarily put themselves on the do not sell firearms list while they're doing well, while they're not having a lot of symptoms. they would have the right to have themselves removed from that list as well. There would just be a waiting period of about 2 weeks between them requesting that and being removed from the list. So it's not permanent by any means. And did just want to note that the Carsey School of Public Policy will be having an event on Wednesday, February 14th, from 8 to 9 a.m. It's called Finding Common Ground, Suicide Prevention Through a Voluntary Do Not Sell List. And the registration for that event will open up on Friday. So if anybody's interested, just let us know and we can get you the information on how to register for that. Next slide, please, Susan.
So advocacy for youth and young adults continues to be a cornerstone of NAMI New Hampshire's work, and much of the legislation across all of our categories impacts youth. But to highlight a few bills specific to youth and young adults, we first have House Bill 1109. This is a bill requiring student ID cards to include the helpline for the National Alliance for Eating Disorders. Some of you may remember that a similar bill passed but was ultimately vetoed due to complications with the organization working the helpline. This new bill utilizes a different organization's helpline, addressing the concerns with last year's legislation, and we're very excited for it to go forward so that youth can be aware of and connected to the services they need. Next, we have Senate Bill 411. This bill would require commercial insurers to cover fast-forward high-fidelity wraparound services, expanding access to those crucial mental health care for youth and families. Finally, many of you are likely aware of the reports of New Hampshire youth in a residential placement out of state last year receiving improper treatment. And there are a couple bills coming forward to ensure that youth in residential placements receive proper oversight and are in therapeutic environments as close to their community of origin as possible. And that bill is House Bill 1573. Next slide, please.
We're also working on a couple of bills around justice-involved individuals. The first one, House Bill 1711, would authorize the state to report mental health data, which would be involuntary emergency admissions, to the federal government under the National Instant Background Check list, which would then prevent somebody who's had an involuntary emergency admission from being able to purchase a firearm. This is a bill that NAMI New Hampshire is not taking a position on. However, we were approached by the sponsor and the co-sponsor on this bill to assist with some language, and we outlined a number of parameters that were extremely important to NAMI New Hampshire, including being able to have yourself removed from the list when you're had recovered, because we know that people with mental illness do recover. We wanted to make sure that any reporting that was done by the courts or the police officers, so that it didn't interfere with the therapeutic relationship between the individual and their psychiatrist. When we started working on the bill with the sponsors, we realized that there would have to be a mechanism for removing firearms from the home. And we were adamant that this didn't end up posing situations where there's a confrontation between law enforcement and the individual. So there was language put in place so that the guns would be removed within 48 hours of the person going into the hospital. And so those are some of the provisions. There are a couple more. You can feel free to reach out to myself or Sam if you'd like more details on this bill. Another bill that we are working on this session is Senate Bill 508. It's relative to the duties of the superintendent of the County Department of Corrections concerning mental health and substance use disorder screening of inmates and coordination for services upon re-entry into the community, which is a mouthful. But essentially what this bill would do would require that evidence-based tools are used in the screening of mental health and substance use disorders. It would also allow for community providers to come into the jails and meet with inmates prior to reentry into the community in order to start setting up services for mental health and substance use disorder prior to the individual being released. Next slide, please, Susan. We're also working on a couple of workforce bills. We held one of these events last year and we've really reached out to folks. And one of the things that we heard loud and clear was that workforce was an initiative that NAMI New Hampshire needed to get involved in and needed to do some advocacy around, knowing how many folks of our folks have extreme challenges in finding providers. So one bill that we were working on, and it's actually, there's a bill in the House and in the Senate. It's House Bill 1190 and Senate Bill 318, which would adopt a social worker licensure compact. The bills are identical in nature, and what it would do is allow New Hampshire to enter into this compact with as many other states as want to join. And it sets up a system whereas if you're part of the compact, then you can automatically be licensed to work in any state that's also a part of the compact. It would allow for a lot of other social workers who live in Maine, Vermont, and Massachusetts to easily practice across the border if those three states join the compact. But it would also allow for things such as if somebody from New Hampshire goes to an out-of-state college, it would allow their therapist to continue practicing and seeing that person if that person went to a compact state, which would be really important for continuity of care. Another workforce bill that we are working on is Senate Bill 403. It's entails a lot of workforce investments. There's two in particular that NAMI New Hampshire is working on and supporting, and those are establishing a workforce pipeline in order to get more doctors and physicians into the state. We know that a lot of primary care doctors are the ones who are treating folks for depression and anxiety. And another portion of it would allow individuals with a bachelor's degree to get some student loan debt relief through this bill. There's about 10 other provisions in this bill that we're not that highly involved in, but we are supporting the entire bill. Next slide, please.
So we know that access to housing is a crucial element of positive mental health outcomes and the workforce shortage, and availability of appropriate housing is an important part of the approach to eliminate emergency department boarding in our state. In regards to housing, there are two important bills we want to highlight. First is Senate Bill 410, which would create a fund in the state to expand and maintain transitional and supported housing through the state's community mental health programs. This bill would make a significant difference in addressing the backdoor problem in regards to ED boarding that Susan talked about earlier. We also have House Bill 1199, titled Relative to the Services of the Office of the Child Advocate for Youth Experiencing Homelessness. This bill enables the Office of the Child Advocate to oversee, create a directory of, and coordinate resources and services for youth experiencing homelessness, including mental health services. Next slide, please. So we hope this overview of our 2024 priorities was helpful. If you want more information on NAMI New Hampshire's advocacy work, you can visit our Take Action page. From this page, you can access a list of every single bill NAMI New Hampshire is tracking. The bills Holly and I highlighted are just a small subsection of the entire list for tracking. You can read our detailed priorities, and you can read all of our testimony from this session and years past. You can also get more information on how you take action and advocate for mental health at the State House yourself. On this page, you can also stories from folks with lived experience drive our work here at NAMI New Hampshire, and it's always a priority of ours to collect those stories. You can click on the Share Your Story tab, and you'll be prompted to write out your story. We will keep track of these stories, monitor legislation that's coming up. And if we think there's a bill that is relevant to your story, we could reach out to you and ask you if you're willing to testify or if you're willing for us to share your story. Lastly, from this page, you can sign up for our public policy alerts, which I'll talk about some more on our next slide. So our public policy alerts are weekly newsletters, usually going out on Fridays, which give you the rundown of important legislation being heard in the coming week. These will equip you with the information and resources you need to act on crucial legislation affecting mental health and suicide prevention across the state. This includes breakdowns of the bills, links to register your opinion on the public record, and even bill updates once we get further in the session. So please absolutely do consider signing up for these. I'll pass it back over to Holly for the next slide.
Thank you, Sam. And I did forget to mention that event at the Carsey School is a virtual event, so you don't have to actually show up in person. It is going to be held online. But just wanted to highlight how much your voice really, truly does matter. This picture was taken at the signing of the budget this past legislative session. Susan and I were asked to come and be a part of that bill signing. And as a result of having mental health voices during the consideration of the budget, over $134 million was included in the budget for Medicaid rate increases. 7-year reauthorization for Medicaid expansion was also in the budget, in addition to Medicaid being postpartum care being extended from 60 days to a year, which we know is so critical for moms who are having postpartum depression or postpartum psychosis and need help with their mental health care postpartum. We know that that doesn't end after 60 days. So it was really crucial to have that in the budget. Additionally, there was sufficient funding to support what you heard Susan talk about earlier, which is the Mission Zero plan to address the emergency room boarding. So there was funding for that plan in its entirety. And this picture was one that we received from the governor's office. And, you know, I'll just read what it says down below. NAMI has never let New Hampshire settle. Thank you for always striving for better results. And it was signed by the governor. And it just goes to show, you know, how powerful our voices can be if we get involved in advocacy. And I will turn it back over to Susan for the next slide.
Thanks, Holly. I will just put out the disclaimer that it was the governor's photographer who cut off his head, not anyone at NAMI New Hampshire, but we really appreciated his sending this to us and cannot thank you all enough for your efforts to help get that budget across the finish line. Oh, there we go. So as we think about what can we all do, I know I'm preaching to the choir here, folks, but just those reminders that, you know, acknowledging that mental health and substance misuse disorders are illnesses. It is so important for us to continue to be advocates and to make sure our policymakers understand that these are not character flaws. These are disorders that are treatable, and we need to make sure that we continue to invest in those resources that help people rebuild their lives and live a full life in their communities. Cannot thank you all enough for your willingness to share your story or that of your loved ones. Please continue to do so. Indeed, we know that the storytelling truly creates change. And although this was a historic budget in terms of its investment in mental health treatment, the reality is we cannot take our foot off the pedal, right? We need to continue to ensure that there is adequate funding for people to get the best care when and where they need it. We also have a role to play in promoting recovery-friendly communities and workplaces where we take away the shame and stigma in order to prevent discrimination and make sure that our friends, our colleagues, our coworkers understand that indeed this is a collective effort and we will support you and we will work together to help folks recover and access the care they need. We also want to continue to really promote peer support. Our peer support partners in the state do incredible work. We are very lucky at NAMI New Hampshire to have a team of peer support specialists who are doing great work, working with folks at transitional housing. And then, of course, our amazing family peer support specialists who do so much, supporting families who are raising children who are experiencing significant mental health challenges. Families like mine years ago, and I cannot tell you how amazing it is when I hear from families who have gone through the fast forward and have the opportunity to have that family peer support, because I know what it's like to walk that journey without that support. So we want to continue to promote peer support and treatments that look at how we treat the whole person. One of the things that we also want to remember, and this goes back deep into our NAMI roots, is the fact that this mental illness has traditionally been seen as the no casserole disease. So when typically you or a loved one have a major illness or injury, your community will often organize the casserole brigade. Unfortunately, for most of us, when we are ourselves needing to perhaps take time off because of our mental health challenges, or we have a loved one who has a diagnosis, most people don't come and offer help or bring a casserole. So we want to always remember that we're going to take care of each other and we're going to bring the casserole. And that sometimes, you know, when it's really hard to hold on to hope, we can help you do that. And finally, here on this slide is continuing to advocate, continuing to raise our voices and advocate, but advocate at certainly the legislature, but also in our towns, as well in our communities, and advocating for ourselves and our loved ones. It's so important. So right here, I want to just take a moment to thank all of our NAMI New Hampshire volunteers who work so hard. Here are some of our volunteers of the month for the last year. We're incredibly grateful to all of you. Each one of you is part of this NAMI New Hampshire family and helps really further our efforts, whether it be facilitating support groups, teaching education programs, or coming out and advocating. We could not do this work without our volunteers. Indeed, I know that our volunteers are there for us at some of our darkest times. And we saw that this past November when we had the tragedy at New Hampshire Hospital, and how our volunteers turned out in the aftermath to offer support. And we're literally out in the freezing cold the night of the vigil, making sure that folks had support and at that very important event. We could not have done it without you. And we are incredibly grateful to each of you every day. So as we look forward to some of what we have on the horizon beyond the legislative session, or during it for that matter, I want folks to save the date for our virtual annual conference. We will be kicking it off with a keynote on March 26th by Dr. Javier Amador. So please make sure that you've saved that evening. And then the next day, we'll have a day full of workshops for you, again, all virtual and recorded. So if you can't make them all, you'll have an opportunity afterwards as long as you register. So that's on Wednesday, March 27th. So please make sure you save those dates and keep your eye out for registration. It will be opening up very soon. And then we are thrilled that we're going to be able to bring This Is My Brave to New Hampshire on May 15th. So save that date as well. And also, once again, I believe this is the 6th annual Children's System of Care Magnify Voices Expressive Art Contest, which will be happening on May 22nd. That if you go to our website, you can find more information about a number of these. And I believe actually you can still submit for the Magnify Voices Expressive Arts Art Contest, which is for youth. And then save the date as well for June 20th. We will have our NAMI New Hampshire annual meeting out in the parking lot under the big tent here at the NAMI New Hampshire office. Can't wait to see you all there. And then back at you on October 6th with NAMI Walks New Hampshire. So this is New Hampshire's single largest event raising awareness around mental illness and suicide prevention. It is also critical in funding our advocacy work. So those funds that you all help raise help ensure that we're able to continue to advocate at the legislature and beyond. And honestly, you can't put a price on on the message it sends when we have over 1,500 of you walking past the State House on that Sunday in October. Oh, I don't know how I went backwards. So a little more, just so if you're interested in learning more about This Is My Brave, it is going to be on May 15th. It will be live in Concord at the Bank of New Hampshire stage. You can save the date. We will be sharing information soon in the near future about where to buy your tickets. But you can also, in the meantime, if you're interested, visit the This Is My Brave website and check out what it's all about. We are thrilled to be able to be hosting it this year here in Concord, and look forward to seeing you all there. I did want to give you a quick update on some of our resources that, our core resources, our services remain largely unchanged, just expanded and hopefully becoming more accessible. In particular, I did share last with you that we have resources we've developed, particularly for folks who are impacted by emergency department boarding. Those are RAC cards that we try to make available at all emergency departments. Please let us know if you'd like them. We also have expanded resources. I mentioned this last year for our BIPOC AAPI population. So that's Black and Indigenous people of color and Asian American and Pacific Islanders. So around mental health resources for those folks, also mental health resources for LGBTQIA+ folks. We have just in this year launched a new resource page for maternal mental health. So want folks to know that that is on our website. Also, we have a web page focusing on substance use and co-occurring substance use and mental health disorders. We've added resources and continue to work on it for immigrants and refugees. And then also want to remind folks that we also have resources for service members, veterans, and their families who have served us all so diligently. So please check that out on our website. If you have things that you think we should be considering adding, you can send that to us at info@naminh.org. If you go to our website and think, oh, this is a really important resource, for example, around maternal mental health that you don't have on there, we are always looking to learn and make sure that we have the most up-to-date evidence-based information that's accessible for our folks. So please let us know if you see things that you think we should be adding and bringing to our website and our resources. I do want to remind folks that New Hampshire Rapid Response is available 24/7, 365 days a year. You can reach them by calling 833-710-6477, call or text, or you can also chat via nh988.com. That is a resource that is very specific to New Hampshire and will allow you to have someone provide an assessment and determine if, for example, would a mobile crisis team response be appropriate for you or your loved one. They may also guide you to go to an emergency department, but it's a wonderful resource. You can also reach it by calling the 3-digit 988 number if you have a 603 area code. So I just want to highlight that right now 988 calls are directed based on area code. So if you don't have a 603 area code, you won't get directly connected with New Hampshire Rapid Response. You will get a highly qualified response, very helpful one. But just it's an important thing to be mindful of, that if you don't have that 603 area code, your fastest way to New Hampshire Rapid Response and those New Hampshire-based resources is through the Rapid Response number. Then also we have several other crisis resources on here, and there is a page devoted just to crisis resources on our website. So please check that out if you're looking for those particular resources. There are a lot of them out there, so remember, you're not alone. And before we take on any questions there might be, just wanted to remind you all how important you are to all of us here at NAMI New Hampshire, and realize that for folks who are doing caregiving, we're not always really good about taking care of ourselves. So please, please remember to take good care of yourself. All those things that we know are important, staying connected with people, trying to get a little fresh air every day, enough sleep, exercise. There are all sorts of things that we know, like practicing gratitude, can help improve your mood and mental health. And sometimes you need to give yourself a break. So remember to be kind to yourself. I think sometimes those of us who are helpers are perhaps don't give ourselves the same grace we give other folks. And to just make my staff laugh, I will highlight the one about practicing saying no. There studies show that the best predictor of how busy you will be next week is how busy you are this week. So try to create some boundaries. I know this is going to come back to bite me. Everyone's going to be reminding me of this one, but it really, really is important. And then just the final slide is where you can find us in terms of our info line, our websites. We've got 4 of them. I think we've got them all on here. And then our social media links are on here as well. We actually have a few others, but I'm gonna stop with these. I'm going to stop sharing my screen. I see there's a lot of things in the chat. I don't know if those are any questions or just sharing resources. Oh, sharing resources. Great. Do we have any questions? Oh, great question from Tina about, are there warm lines in New Hampshire? Thank you, Tina. That's a really important question. And also one that I'm thinking we should make sure we include in our slides. So our number of our peer support agencies in the state, there are 10 in the state. They are amazing partners. A number of them do offer warm lines with various hours. That should be on the information about the peer support agencies, I believe, is on our website. That said, I suspect I've now sent a staff member into scrambling looking for it. But Tina, thank you so much, because that is a very important resource that people should know about. Our peer support agencies, most of them offer warm lines at least several evenings during the week. And there you go. There's the peer support agency. Thank you, Kim. So the only other thing that I would highlight, and we kind of didn't touch on it when we hit that slide in terms of our DEI work, is we have coming up tomorrow a webinar using actually our new online learning platform. And that webinar is in little tiny print on this piece of paper: mental health and suicide prevention among LGBTQ+ youth. So you can find out more about that at our website. It will be recorded and available in the future. However, if you're looking for continuing education credits, you would need to sign up and attend it when it is offered tomorrow. And I think with that, I'm going to turn it back over to you, Todd.
There is
Got
another
a couple more
question, Susan.
questions. Yeah.
There's another question. Sorry.
So next question, is there any work for getting equality with health insurance and LTD policies, long-term disability policies?
That's a good question, Tina. I don't have an answer for that right now, but if you want to there's nothing that I've seen in the legislature, or that I've worked with, around equality, around health insurance. I'm not sure what you mean by that, but you did explain about, that many companies limit long-term disability to 2 years for mental health reasons. And it's interesting. I'd have to look into that, Tina, to find out, but more than happy to take a look into it and see if there's any kind of parity work around long-term disability insurance. If you wanted to drop your email in the chat, if you feel comfortable doing that.
Or Tina could email us at advocacy@naminh.org as well. Or at hstevens@naminh.org. There you go.
And Tina, there is something called the Parity Act, which is a federal act, which basically says that your copays for mental health should not be any more than copays for comparable medical surgical benefits. So if you're having an issue with that, I would contact the New Hampshire Insurance Department, and I can give you the information on how to do that. But if you go to the New Hampshire Insurance Department's website, there will be a place for you to make a complaint, and you can make a complaint that you're being charged more for copays for your mental health appointments than you are for your other medical appointments, and the insurance department will take a look into that for you.
And I want to point out that that webinar I mentioned tomorrow actually won't be recorded. There will be another version for a self-paced version of that webinar on our online learning platform coming forward. So you will have the opportunity. So my bad, it's not actually recorded tomorrow. You got one shot. All right.
Any other questions? Okay. Well, I really want to thank everybody for joining us on this town hall today, and we really do truly appreciate you. A link to the recording will be shared with all the registrants this evening. Kim, is that going to be sent out this evening?
It will not be sent out this evening, but it will be sent out by the end of this week.
Okay, very good. And also links to the resources discussed in this evening will also be sent to the registrants too. Once again, we're very grateful for the opportunity to partner with all of you in our collective work to improve the lives of Granite Staters affected by mental illness and suicide. And with that, I just want to say good night and have a good evening. And stay safe in this weather.
Take care, folks.